Hello and welcome, my friends. I shared with you in an earlier video about a wonderful case of alopecia, how homeopathy has helped that young girl, and that is one of my continuations to that video. I'll be sharing with you the Comparative Materia Medica of Alopecia of a few very interesting lesser known remedies. So if you think of the Comparative Materia Medica, it's always important to understand in your practice how you can differentiate related remedies. One of my first medicines in this group, which has helped me in the past as well, is Helium Metallica. You'll find this in your Boricase Materia Medica, Helium Metallica. As it's a metal, do remember for thallium there are 3-4 important factors. One of your leading remedies for alopecia after any exhausting disease. So think of today's world where post-COVID people are losing hair, so alopecia post any exhausting disease. Thallium has a very good action on the endocrinal system, especially thyroid, especially adrenal. So if we consider thyroid malfunctions, thyroid dysfunctions with hair loss, your thallium will help. Adrenal malfunctions with hair loss, your thallium will come in handy as well. In today's modern day world where you have alopecia after an HRT, in those cases also thallium will come to your rescue as well. 200C 1M is the choice of potency for Thallium Metallica. Think of cases where you have prescribed the constitutional remedies but it's still not providing results. Thallium Metallicum can come in handy post HRT alopecia, post acute exhausting disease alopecia, and with thyroid and adrenal dysfunctions, there is alopecia, which is such a common problem plaguing today's 21st century. Thallium in 200C and 1M can come into your rescue in those cases. My number 2 in this list is Mancinella, another fantastic medicine, not lesser known but medium-sized remedy. Another remedy for alopecia after exhausting disease. So alopecia after COVID, alopecia after any exhausting disease, any acute disease. But one of the factors you have to understand for Mancinella is it's a remedy specially adapted for the puberty and the menopausal age group. Women with hypersexuality, men with hypersexuality at puberty and the time of andropause or menopause with hair loss, and that is one of the very important factors for Mancinella. Mancinella works in 30C and 200C. So you'll find in Boricate it's mentioned in mentally depressed states at puberty and at climacteric. So when you have hair loss, especially after an acute disease with a lot of depression, sadness, Mancinella can come in to your case to help in those depressed states. So Mancinella in 30C and 200C is important. So difference with Thallium and Mancinella, in Thallium you don't have that degree of sadness or depression associated with the hair loss. But in case of Mancinella, you understand, Herring mentions this, mentally depressed states at puberty and at climacteric. So the depression with the hair loss post alopecia, that's Mancinella. Without the depression, think of Helium Metallica. Number 3 in this list is Vinca Minora. In case of Vinca, there are patches of baldness, spots of baldness in Vinca. And with the spots of baldness, there is a lot of itching in the scalp, Sometimes there is oozing of moisture. The oozing mats the hair together and that leads to the hair loss. So it goes in phases where you have the oozing followed by the matting, and that is ultimately resulting in the hair loss. So that's important for Vinca Minora. One of the very interesting points about Vinca, you have to understand that in Vinca there is hair loss, but after the hair loss what comes out is grey hair from that area. There's a very good clinical tip. Clark mentions this in his Dictionary of Materia Medica, that once you have the baldness, hair comes out after the medication, but the hair which comes out is grey hair. Vinca will help you to correct the dyscrasia, resort to his original hair. Also it will correct the baldness as well. So that's very important for Vinca Minora. So on one hand you can get oozing with matting and hair loss where there is a lot of itching of the scalp. On the other hand, there is hair loss, but if hair is coming out, it is grey hair in case of Vinca Minora. Sometimes in Vinca what can happen, the bald spots are covered with thick woolly hairs as well. So thick woolly hairs can come out, or you can get sometimes is the grey hair coming in from that area. My number 4 in this list for Comparative Materia Medica for alopecia is Fluoric Acid. I shared with you Fluoric Acid in my previous video where I failed with Fluoric Acid. hot syphilitic patients is fluoric acid. So in a hot syphilitic, when you come across hair loss, itching of the scalp, remember fluoric acid is always better by cold, worse from warmth. So hot syphilitic with itching scalp, better from cold, worse from warmth, is important for fluoric acid. And fluoric acid always has a premature old age. They look old, they look feeble because they are an acid. So you have to remember that appearance of old age, premature old age, is important for fluoric acid, who is a hot syphilitic. Vinca, I forgot to mention the potency. Vinca is 30C. Fluoric acid also 30 and 200 works best. Number 5 in this list, my friends, is our celebrated good old friend Arnica. Arnica montana can help you in hair loss after a shock, sudden financial loss. Stock market came crashing down and you're starting to lose your hair. So hair fall after a shock, Borique mentions this, especially in italics in the introduction. After sudden financial loss, Arnica can help you in those cases. And in those cases, do always use a higher potency is 200C 1M, where hair fall starts after an emotional shock, like a sudden financial loss, if you are in the stockbroker's business. Number 6 in this list, my friends, is jaborandi. You will find this in Borique mentioned under pilocarpus. What is interesting for this remedy is you have profuse sweating. You will find this mentioned Borique. It is homeopathic to abnormal sweat, so profuse sweating, but there is dryness of the scalp. So there is profuse dandruff with dryness of the scalp, but the rest of the body sweats profusely. Profuse body sweats is homeopathic to abnormal sweats. It's one of your remedies which sweats profusely, but the scalp is dry with a lot of dandruff. You can use pilocarpus jaborandi in 200C. It's useful to apply locally as well in tincture on the scalp mixed with coconut oil. Jaborandi 200C works well. Jaborandi also a very useful remedy for menopausal hot flush with a lot of sweating, but there is a lot of hair fall with dryness of the scalp and a lot of dandruff. Jaborandi helps in those cases as well. My number 7 in this list, my friends, is phosphoric acid. If you consider phosphoric acid as a remedy for hair loss, you just cannot consider that because it's a polycrest. But you have to understand for phosphoric acid that there is a history of grief, there is a history of disappointment, there is a history of homesickness in the past history, in the life of the person. And that grief, that disappointment, that homesickness perhaps resulted in diabetes mellitus, perhaps resulted in chronic fatigue syndrome. So with debility. So if you consider the etiology, it can be grief, it can be a disappointment, it can be homesickness, and that is resulting in a lot of debility in phosphoric acid. And with the debility, you may have diabetes mellitus, you may have hair fall, and you may have premature graying of hair. I have another video on phosphoric acid. You can have a look of that for the detailed understanding of phosphoric acid. But considering the hair fall picture, premature graying, hair fall with diabetes mellitus with a lot of debility which starts after this etiology is very important for phosphoric acid. And lastly, to finish up, my last medicine in this list is sepia. If you think of sepia, obviously the emotional picture is important, the stasis. Again, I've discussed in details about the emotional picture of the indifferent sepia. So with the stasis, when you have lack of emotion, lack of joy, there is a lot of indifference, grief, weepiness, and there is hair fall as well with the chronic headache of sepia. But you have to always give importance to the emotional picture of sepia while prescribing in those cases. Phosphoric acid 200C and 1M, sepia similarly 200C, 1M, 10M, even the higher potencies of sepia works best. Two medicines which I like to finish up with, which work well as local application. I already mentioned to you jaborandi, which can be used as a local application. Arnica can be used as a local application. My number 9 in this list is Ceanothus americanus. Cyanothus, if you find in Boricae, it mentions about it used locally as a hair tonic. So Cyanothus is a remedy for splenic enlargement, splenomegaly. So anemic patients with a lot of hair loss, splenic enlargements, you can use Cyanothus locally as a hair tonic. And number 10 in this list is Cochlearia. Cochlearia is a remedy which has excessive dandruff. So a lot of dandruff, and again Cochlearia is mentioned in Boricae as locally cures dandruff. So you can use locally as well for Cochlearia. Whenever you are using these remedies locally, you use tincture. You can use the tincture directly on the scalp. You can mix it with the coconut oil. You can apply it on the scalp as well. So Cochlearia, Cyanothus, Jaborandi or Pilocarpus and Arnica can be used locally as for hair loss. Alopecia, my friends, you have to understand the best way forward is constitutional treatment. But I'm sure these lesser known remedies can come in handy, especially when your constitutional remedies have failed. You're prescribed a pulsatile, you're prescribed a sepia for hormone irregularities, but you are not considering thallium in that case. Depression with hair fall, you're prescribed natrum mur. You are not considering Mancinella in the case. So give importance to these lesser known satellite remedies which can help you when your constitutional remedies are not working in the case. Thank you very much for your kind attention. Long live Hanuman, long live me.